Hello everyone and welcome to the TAS Morning Show. So we'll be chatting today with Dr. Mudathir, who is an osteopathic doctor who also has keen interest in sports injuries and spinal conditions. So let's find out more what exactly osteopathy is and how osteopathy can provide a holistic approach to a patient. Welcome to the show, Doctor.
Thank you very much for having me. I appreciate it.
Thank you so much. And also wait till the end because we have a fun rapid fire round. So doctor, me and the viewers, we would like to know what exactly osteopathy is and how osteopathy is different from allopathy.
Okay, so osteopathy is a holistic medical branch of medicine whereby we treat patients with varying symptoms holistically. So we treat conditions such as low back pain, neck pain, headaches. We treat babies, elderly people, wide range of people.
Right.
How it differs from your traditional allopathic medicine is very simple, really. With osteopathy, we don't prescribe medications, and it's a non-invasive treatment regime.
Right.
With osteopathy, we use our hands a lot. We also use treatment modalities, and we treat holistically, as I mentioned.
So, well, I've just understood that your treatment style is a little different than the other doctors around. How would you treat a person who comes back probably with a lower back pain? Because that's very common. So what would an osteopathy doctor advise for a lower back pain patient?
Okay, so we see a high number of people with lower back pain here in the country and elsewhere. Typically, the first introduction would be a consultation, whereby we take the patient's detailed case history about their symptoms and how they injured their back, whether it's a chronic or an acute problem. And then moving on from that, we perform thorough examinations, whereby we perform neurological examinations, abdominal examinations, physical assessments, postural assessments, and other myotomal examinations as well to determine the root cause of the problem. Once we're able to formulate a diagnosis to the patient, we sit down with the patient and discuss a treatment plan of how we can help them, if we can help them. Once the patient is aware of their diagnosis, then we perform the treatment during the consultation and then advise them to come for sessions to treat the condition that was discussed with them.
So I'm guessing that osteopathic doctors perform cracking of the bones and all also, right? But it's similar, I guess, to the chiropractors. So could you tell me how osteopathy stands apart from chiropractor?
Typically, traditionally, chiropractors tend to do the spinal adjustment or the cracking, as people know it, of the spine. So they will do the adjustment of the neck and the thoracic spine and into your lumbar spine as well. Some chiropractors also do adjustments of other joints as well, but traditionally, it's about mobilizing the joints with chiropractic medicine. With osteopathy, I guess the main difference is we treat holistically, as I keep mentioning. By that, in detail, I mean we do perform the spinal adjustments as well, and we are able to mobilize and adjust the joints of the body, but we also focus on the muscles, the ligaments, the organs, and the soft tissue structures within the body. So we have a wide range of techniques in order to treat patients on a bigger scale, I would say.
Okay. Osteopathy, the concept of osteopathy is quite new in Oman, I believe, because a lot of people don't know yet about it. So how do you feel that Oman is able to accept osteopathy doctors now? What's the situation like in the market? Let me know. Okay.
So typically, traditionally in the country, the medical care revolved around allopathic medicine, medical doctors, and physiotherapy, and more so in the last 5 or 6 years, I'd say chiropractic has been introduced as well. Osteopathy is very new in the country. However, the demand and the knowledge and the health awareness of our medical style of treatment is increasing massively. We focus a lot on health education and how we promote our services, but at the same time, through seeing the patients in the clinic and their improvement, the word soon gets around that osteopathy does have massive benefits for people's health.
So how, like, say for instance, if a person walks in, like you just mentioned, with a backache or anything as such, like, you know, you have a different way to treat them. I would also like to know, like, what about those people who are still not sure about osteopathy, like the analytical people? How do you try to convince them in order to, you know, undergo a treatment in osteopathy?
See, the thing is, a lot of people believe or think without any prior knowledge that osteopathy is a complementary or an alternative style of medicine.
Correct.
It's very much a primary source and a primary intervention for medicine, and this is how it is in the Western Europe and in the States, for example.
Right.
In Oman, it's considered a complementary medicine, which isn't the case. We heavily pride ourselves and our field of medicine through evidence-based research, and we like to reflect that within our consultation, our treatment plans. For example, in answer to your question, when somebody comes to see me for a consultation, we will obviously take a detailed case history, but then obviously move on to detailed analytical special tests and examination procedures in order to formulate treatment plans.
Correct.
So we don't just determine diagnoses just from case history or from what the patient informs us, but also through evidence-based research testing, be it neurological or postural assessment or biomechanical analysis. So this is what formulates our medical diagnosis.
Right.
Once we have that, we're able to explain that to the patient.
Right.
And another point to mention is as well, some patients come here without knowing what their problem is.
Correct.
So by giving them an answer to their issue, they are already 50% there in terms of what they need to do and what we need to do in terms of helping them get to where they need to be.
Okay. So I actually, you know what, I'm really keen in knowing if there was any kind of challenging case that you came across, and if so, then how did you treat the patient? It could be a challenging case in trying to convince the person in order to undergo an osteopathy session, or it also could be a challenging case in terms of like the person wasn't really, you know, like you knew the case, but then you had to check with a few doctors around to get more information on it, how to deal with the case. It could be in any terms. If you had a challenging case, please let us know.
Okay, so I think for us, every case is challenging for the reason being that the treatment plans that we try and provide is with a view to giving honest treatment for their recovery.
Right.
But in particular, one that stands out to me, I would say, is we have now introduced sports medicine into the clinic. Having been a professional athlete in the past before, I'm very interested in the sports medicine side of things.
Yes, I've heard. Yes, yes.
And we see a lot of elite athletes,
Right.
for example, triathletes, runners, cyclists, swimmers.
Right.
But in one particular case, there was a patient that came in who had aspirations of competing at a very, very high level. Obviously, for confidentiality reasons.
You cannot share, that's fine. It's perfectly all right.
But it was a young gentleman that came in
Yeah.
who was very, very healthy and very, very in shape, who suffered from a lower back injury, a disc injury in particular, through his training, through his weight training. He was very against surgical intervention because of his health and his effect it may have on his sport and his career.
Correct.
And he was at a turning point whereby his sporting career was now taking off. So the injury set him back a little bit, and obviously psychologically that had an effect as well.
Correct.
So it was challenging in a way, not just by providing the correct diagnosis and treatment plan for him to recover, but also trying to assess the contributing factors and the environmental factors which affect elite athletes in this day and age.
Agreed.
Which is one of the differences of how osteopaths tend to treat. We treat holistically, not just by the person, but also discussing about the contributing factors, which is why that person is in the situation he's in. Is it just from an injury, or are there other factors that affect it?
Right.
So, for example, with this patient, we had to focus on his nutrition plans.
Right.
We had to focus on his exercise physiology and his personal training programs. We had to focus on his treatment modalities. We had to focus on his commitment outside of the clinic in terms of his workout and training programs that complement what we do here in the clinic, to make sure that his functionality and his dynamic approach to his performance was at the highest level for him to attain his goals.
Correct.
And basically this gentleman wanted to compete for the country and compete inshallah one day at the Olympics on the Olympic stage.
So which actually, you know what, is pretty good, like good information for me, and it brings me to my next question. Like, do you as an osteopathy doctor, do you even give the regular medicines, like the medications which an allopathy doctor gives? Because I believe if a person wants to heal as soon as possible, like a sports gentleman, he wants to heal as soon as possible. So how long does the whole process take? And if you don't give the regular medications, how does the healing process happen?
So as osteopaths, typically we don't intervene with any medication.
Correct.
We believe that the body is able to heal itself by treating holistically, by providing the internal environment for the body to heal through treatment modalities and treatment advice. So we are not, typically we don't give out medications. we can advise accordingly and say, look, this will help with some anti-inflammatory conditions you
Right,
have, but it's
right.
not a heavy focus that we try and promote.
Right, right. Right.
In terms of the prognosis of people's injuries and people's conditions, medication tends to be a very short-term fix. People get medications because they want quick relief, understandably.
Yes.
But it's not always good for your system and good for your internal organs.
Right.
So we try and educate the patient that sometimes our treatment plans don't have an immediate effect.
Right.
It's a process, but it's a healthier process.
Correct.
Which means your body is less likely to revert to the stage that it was at the beginning,
Right.
and more likely to recover naturally.
Right.
Which is the idea of good medicine, I
It
believe.
is. The body heals on its own, so you
Exactly.
should give it time as much as possible.
Exactly.
Which is great, because I have also read that you have experience in food and nutrition. So how does food and nutrition help with the osteopathy, subject? How does it help?
An immediate collaboration,
Okay.
for sure, an immediate connection. Obviously, with osteopathy, we promote health.
Right.
Nutrition is a big part of health. In order for people to recover from injuries and conditions, they have to provide the right nutrients to their body.
Correct.
So it goes hand in hand in terms of their performance if they're athletes, or their improvement with their treatment. So what we do in the clinic here as well, we do provide treatment, nutrition regimes and programs for patients should they wish to go down our exercise physiology route.
Right.
And also we advise our patients on what to eat and how much to drink water, for example, just to
Right.
help with their recovery. So
Right.
they're leading a healthy lifestyle outside of the clinic and also maintaining their treatment with us. You have to think as well with patients that come here, they spend an hour with us in the clinic, but 23 hours of the day they're outside.
Exactly.
So as much as we can't control what
Yeah.
they do outside,
Yeah.
we have to be able to advise them properly
Yeah.
so that they get the best out of the clinic.
All right, so last but not the least, do you have any advice for our aspiring doctors out there who are watching us, and they want to also pursue medicine, but they're still not sure which doctor they should be? So even if they know what doctor they want to be, like, how is their journey going to be ahead? Like, could you just let them know?
Okay, so I would say if you are pursuing or wanting to pursue a career in medicine, obviously there's different branches of medicine, choose wisely. However, if you are ready to work and be disciplined and be focused, because it's a long journey and it's a very, very difficult course, but the patient satisfaction and the rewards are huge. Good ethics, being a good people's person and being relatable to your patients, I would say are the top 3 key things to take you to that next level of being a great doctor. So I wish you all the best.
Perfect. That's amazing. That's a good way to wrap up our question answer round. But we also have our fun rapid fire round as usual. So are you ready?
Ready.
Okay. Perfect, doctor. All right. So this is more relaxed and chill. So you can be yourself. All right.
Let's do it.
All right. Perfect. So the first question is, if you were to describe yourself in 3 words, what would they be?
In 3 words,
Yes.
I would say I'm relatable to people.
Lovely.
I am extremely loyal and honest.
Perfect.
Honest person.
All 3 key things that a doctor should be.
I think so.
That's good. What is that one goal that you would like to accomplish this year? It could be a goal or a bucket list thing, anything. Yeah.
I would like to definitely expand into the corporate industry in Oman, and also continue to increase awareness of osteopathy.
Right.
But particularly branch out into the corporate sector, I would say.
Okay, lovely. Good luck to you.
Thank you so much.
All right. So if you hadn't been an osteopathy doctor, then what career you would have chosen? I believe it's something to do with sports, because that's what you wanted to do, I guess, right?
So this is a very good question, actually. As a child,
right.
Strangely,
Right.
I always wanted to be an astronaut.
Right. Oh, okay.
Or an American footballer.
Okay.
So very, very different. This was when we used to live in London.
Yeah.
But certainly, obviously, things changed as I was growing up.
Right.
Having played professional basketball in the past, I would say definitely if osteopathy wasn't my choice, I would definitely go into playing professional basketball.
Lovely. Professional basketball. Amazing. You could still play You could still play.
I could if I had the time.
True. Which brings me to my next question. What do you usually do on the weekends if you're not working? I guess you could play basketball.
I'm always busy.
Okay.
I would like to get back into basketball for sure. But I do spend a lot of time with my family.
Right.
I have a young family as well.
Right.
My daughter's a big swimmer at the moment.
Lovely.
So we support her with that a lot, and we like to spend time together. We like beaches and
Okay.
exploring and spending time together. Yeah.
Awesome. Okay. What about this? What's your best favorite place in Oman? Like, where you go and relax. What's the favorite place in Oman?
Favorite place in Oman? Oman is home to me, so everywhere is my favorite place.
Lovely,
if I'm in the clinic, if I'm at home, it's my favorite place.
Lovely.
But I would say I've always been a big water person, so as long as I'm by a pool or by a beach, I'm happy.
So beach is your favorite place?
Beaches are
Any beach?
Any beach.
Amazing,
Muscat
amazing.
Hills Beach is awesome. We like that. Super Beach is great.
Lovely.
But yeah, definitely a beach.
So we can find you on a beach on a weekend for sure.
I'll be there.
Lovely, lovely. Thank you so much, Doctor. It was amazing chatting with you.
Thank
you so much. We've got so much information regarding osteopathy and wish you all the best for future.
Appreciate it. Thank you for having me.
Thank you so much. Thank you for watching the TAS Morning Show. For more updates like these, follow the Arabian Stories.